So hello student, very good morning to everyone. So in the last lecture we have started with pharmacodynamic agent. So these are the points that we have covered in the last lecture. So the pharmacodynamic agents are the drugs which are used to correct the disorder in the physiological functions and restore them to normal condition. That drugs is called as pharmacodynamic agent. Then again in the last lecture we had learned classification of drugs, classification of CNS drugs. So you know that the CNS drug has been classified into three types. That is based on the pharmacological activity. The CNS drug is classified into three types. That is CNS depressant, CNS stimulants, and CNS modifiers. Then CNS depressant again is classified into two types, that is non-selective CNS depressant and selective CNS depressant. So CNS depressant means these are the drugs which have depression action on the CNS as its principal pharmacological action are known as CNS depressant. So this CNS depressant again classified into two types, that is non-selective CNS depressant and selective CNS depressant. So selective CNS depressant means those drugs which selectively depress certain region or portion of CNS are known as selective CNS depressant, and it includes tranquilizers, analgesic and anticonvulsants. While non-selective CNS depressant, these are the drugs which are produce a generalized depressant action on central nervous system, that is called as non-selective CNS depressant, and it includes hypnotic and sedatives, general anesthetics, central muscle relaxant. Then the second type is your CNS stimulant. So CNS stimulant, these are the drugs which stimulate and reactivate the central nervous system are known as CNS stimulant or antidepressant. So again it classified broadly into four types, that is cerebral stimulant, respiratory stimulant, analeptic or restorative stimulant, then a psychomotor stimulant, and your last type is CNS modifier or tranquilizers. So these are the drugs which employed in the treatment of mental disorder. So these CNS modifiers are used to treat the mental disorder, and they produce specific improvement in the movement and behavior of the patient. Then again in the last lecture we had learned the characteristics of this CNS modifier. So the first characteristic is it should not have toxic effect, and the second one is it should not produce other undesirable side effect. It should not have calming effect. It should have calming effect without causing sedation, and it should not result in unconsciousness. These are the points that we had covered in the last lecture. Again, one more important point that we are learning in the last lecture, that is concept of hypnosis, sedation, and anesthesia. So you know that the sedation and hypnosis are closely related terms, which means the different extent to which CNS is depressed. You know that hypnotic is a drug which produce sleep resemble to the natural sleep, while sedative is a drug which produce mild depression, calm anxiety without causing drowsiness or impaired performance. So and then so yeah, you know that the hypnotic and sedatives are differ in the action quantitatively. A sedative, when given in a large dosage, it acts as a hypnotic, and hypnotic, when given in a small dosage, it acts as a sedative. Further, it is observed that increase in amount of dosage can lead to anesthesia and finally coma. However, if the depression reaches to medulla region, then it causes death. The effect of again we have learned the effect of increasing order of dosage, that is sedation to hypnosis to anesthesia, anesthesia to coma, and coma to death. So these are the points that we have covered in the last lecture. So today we are going to learn the classification of CNS drugs based on pharmacological action. So this CNS drug has been classified into this six type, that is Phenytoin. These are the chemical class. The first class is Phenytoin, oxazolidine dione, benzodiazepine, then pyrrolidones, phenylpropylemine, phenothiazine. So these are the six classes of this CNS drug based on its pharmacological action. First one is Phenytoin, oxazolidine dione, benzodiazepine, pyrrolidones, phenylpropylemine, phenothiazine. So now we'll see one by one the chemical class of this CNS drug. So first class is Phenytoin, and the example under this class is Phenytoin, or it is also called as Dilantoin. So this is the example of Phenytoin, and its name is IUPAC name of this Phenytoin is 5,5-diphenyl Phenytoin, and this is the general structure of Phenytoin. So this Phenytoin was the first anticonvulsant drug which shows a clear difference between anticonvulsant activity and sedative hypnotic activity, and it also acts as a sodium channel blocker. So this Phenytoin, this Phenytoin is also act as a sodium channel blocker. So this is the general structure of Phenytoin, and the example of this Phenytoin class is this Phenytoin. So Phenytoin having two phenyl ring at carbon number 1, 2, 3, 4, 5. So this is your carbon number 5. At carbon number 5, there is having two phenyl group. So this nitrogen is your carbon atom number 1, 2, 3, 4, 5. Numbering is like this: 1, 2, 3, 4, 5. And now we'll see the uses of this Phenytoin. It is also used in the treatment of all type of epilepsy, that is and for trigeminal neuralgia. So this drug has been used for the treatment of all type of epilepsy. मराठीमध्ये त्याला इपिलेप्सीला फेफरे म्हणतो, फेफरे येणं. आणि and for trigeminal neuralgia. And another use of this drug is it is also used for the treatment of cardiac arrhythmia, specially induced by digitalis. So it is also used in the treatment of heart related diseases, especially induced by digitalis. So this digitalis is related to heart. So it is used in the treatment of heart related disease. And the side effect of this Phenytoin is that the side effect of this Phenytoin is it causes dizziness, चक्कर येणे, it causes itching, खाज सुटणे, and skin rashes, स्किनवर पुरळ वगैरे येतात. Then vomiting and blood vision, that is उलट्या आणि अस्पष्ट दिसायला लागतं. And tremors and fever, that is tremors with हात पाय कापतात आणि fever म्हणजे ताप. So these are the side effect of this Phenytoin, that is dizziness, itching, skin rashes, vomiting, blood vision, tremors and fever. So this is all about Phenytoin, and under this class we have taken the example is that is Phenytoin or Dilantoin. So this is all about that first class. Then second class is Oxazoline Ion, and this is the chemical class Oxazoline Ion, and under this chemical class we are going to take the example is for study is trimethadone or trimethadone or tridone. This is the derivative of this oxazoline ion. So this is the general structure of oxazoline ion, and this is the structure of your tridone or trimethadone. So this when NH, so what when you see that the phenytoin and this oxazoline having same structure, the only difference is here in your phenytoin in hydantoin here having NH. So when this uh, NH of hydantoin is replaced by oxygen, you will get this oxazoline ion. So when NH of group of position at first of hydantoin nucleus is replaced by oxygen atom, it forms oxazolidine 2,4 dione. It is called as oxazolidine 2,4 dione. So these are 1, 2, 3, 4, 5. So this oxazolidine 2,4 dione, and so this the uses of this oxazolidine ion is it is mainly used to treat for it is mainly used as a anticonvulsant drug in the treatment of grand mal epilepsy, and it is also used in the treatment of all type of epilepsy, and sometime in combination with phenytoin. This drug has been used in combination with phenytoin, and it is used to treat petit mal epilepsy when other drugs are not effective. Then this combination of phenytoin and this oxazolidine ion is used to treat this petit mal epilepsy. Then the side effect, what are the side effect of uh, this tridone? The side effect of tridone is it causes skin rashes, then it causes exfoliative dermatitis, exfoliative dermatitis. So this exfoliative dermatitis, it is actually a skin disease. Then blood discrepancies, abnormality in blood picture. Then it also causes kidney damage and hepatitis, that is it disease related to your liver. So these are the side effect of this oxazolidine ion, and this is the general structure of oxazolidine ion. And in tridone, this R1 R2 is replaced by methyl group, and this R3 is also methyl group, and the name of this tridone is 3,5,5 trimethyl 2,4 oxazolidine dione, and it is used as an anticonvulsant in the treatment of grand mal epilepsy, and in combination with phenytoin it is also used in the treatment of petit mal epilepsy. And these are the side effects, that is skin rashes, ex, uh, uh, side effect is exfoliative ex, exo, ex, ex, exfoliative dermatitis, blood discrepancies, exfoliative dermatitis, blood discrepancies, kidney damage, and hepatitis. Then the third class is benzodiazepine, and the example under this class is alprazolam. So this is the general structure of your benzodiazepine. So in benzodiazepine, the aromatic ring is fused with 7-membered heterocyclic ring. So in benzodiazepine, this is you are having aromatic ring, and aromatic ring is fused with 7-membered ring, heterocyclic ring with aryl group substituted at 5 position, with aryl group substituted at a 5 position. The benzodiazepine are the drug which have depressant action on the CNS, hence they are known as CNS depressant. The 1,4-benzodiazepine class of the drug are mainly used as an anti-anxiety agent, as a sedative and hypnotics. It is also found that it passes anticonvulsant and muscle relaxant property. So this is the general structure of your benzodiazepine, and numbering start from this nitrogen atom: 1, 2, 3, 4, 5, 6 and 7. 1, 2, 3, 4, 5, 6. So in this is the general structure of your benzodiazepine, and where R is equal to hydrogen or alkyl group, this R is equal to hydrogen or alkyl group, and this X is equal to oxygen or sulfur, and Y is equal to chlorine or nitro group. This Y is equal to chlorine or nitro group. So when another heterocyclic ring is fused at 1,2 position, at here 1 and 2 position, it gives 1,2 annihilated 1,4-benzodiazepine, and which found to be better activity, or which found to have better anti-anxiety agent. When this 1,2 position is substituted, that derivative have been better anti-anxiety agent. So this alprazolam is obtained by fusing triazole ring. So this is your triazole ring with 1,2 position. So here here is your nitrogen. There is one mistake here. So here is your nitrogen is there, nitrogen, and here is also nitrogen. Let me take eraser. So here is also nitrogen is there, and that is called as triazole ring. So this alprazolam is obtained by fusing triazole ring at 1,2 position of 1,4-benzodiazepine, and it is an anti-anxiety agent and also used as a sleep inducer. So the uses of this alprazolam is, it is used as an anti-anxiety agent and also sleep inducer, and the side effect is it causes drowsiness and lethargy. It also causes drowsiness and lethargy, means chakkar yene आणि susti. It causes drowsiness and lethargy. So this is the about third classes, that is benzodiazepine, and the example is alprazolam. So this is the structure of alprazolam. Then next class is pyrrolidone. Next class is your pyrrolidone. So this, under this pyrrolidone class, we are going to learn this example. We are going to take this example, that is levetiracetam, and is also called as Keppra, levetiracetam, Keppra. So these are the pyrrolidone substituted. So this ring is called as pyridine, and due to this carbonyl group, it is called as pyrrolidone. So this pyrrolidone, these are the pyrrolidone derivative of substituted amide. They are mild mood elevators. So these drugs are mild mood elevator, causing sense of well-being. It causes sense of well-being, and thus these drugs have favorable effect on mind. Thus these drugs have favorable effect on mind, and sometimes this drug is called as nootrops. So nootrops is the drug which increases the memory or enhances the memory. So it also called as nootrops, and nootrops means it also the role of this nootrops drug is it enhances the memory. Then the uses of this Keppra is, it is used as a anticonvulsant, and it is used and also used to treat epilepsy, and it is used for partial onset myoclonic or tonic-clonic seizures. It is found to be useful for the psychiatric and neurological conditions such as Tourette syndrome, anxiety syndrome, and Alzheimer's disease. So this Tourette syndrome is related to nervous system. So in this Tourette syndrome, the repeated movement or unwanted sound will be shown by the patient. The patient which is suffering from this Tourette syndrome shows a repeated movement of hand or legs, whatever it may be, and unwanted sound, uh, unwanted sound coming from his mouth, and uh, it is also used in treatment of anti-anxiety disorder. That is this anti-anxiety disorder. It is a mental health disorder characterized by uh, feeling of worry, anxiety, and fear, and that are strong enough to interfere with daily activity. So this disorder means it's a mental health disorder which cause the feeling of worry. The person feel worry, anxiety, and a person feel fear, and that this this emotion are strong enough to interfere with the daily activity. And the next one is Alzheimer disease. So this Alzheimer disease, this related to your brain. It's a mental disorder. So it is also used for the treatment of Alzheimer's disease, that is shock-like jerk of muscle. So in this, the person which is affected with Alzheimer's disease, uh, which shows this shock-like jerk of muscle. Then the side effect of this levetiracetam, levetiracetam and Keppra is it causes drowsiness, means tandri, in Marathi is called as tandri. Then dizziness, chakkar, unusual tiredness, then weakness. So these are the side effect of this Keppra, that is drowsiness, dizziness, unusual tiredness, and weakness. The next class is phenylpropylamine, and under this class, the derivative of this the example of this class is amphetamine. So this is the structure of this amphetamine, and so there are two classes of this phenylpropylamine are there, that is phenyl N-propylamine and phenyl isopropylamine. So this phenylpropyl having two classes, that is phenyl N-propylamine and phenyl isopropylamine. So this comes under isopropylamine. Your amphetamine comes under isopropylamine. So both the class are used as a antidepressant drug, that is N-propylamine and isopropylamine. Both these classes are used as a antidepressant drug, and they are also used in the treatment of obesity, latapana, They are also used in the treatment of obesity, and they also reduce appetite. They also reduce appetite. So in appetite, the person who is affected by this appetite has no desire to eat. Means loss of it. A person has no desire to eat. त्याला खाऊ असं वगैरे काही वाटत नाही आणि जेवण करण्याची इच्छा नसते त्याची. So that time you are to treat this, if the person having obesity and appetite, so you can use this drug, that is amphetamine, to treat this obesity and appetite. So this is the uh, amphetamine. This is your amphetamine, and it is derivative of phenyl isopropylamine. Phenyl isopropylamine is the name of this compound, is amphetamine, and it is a derivative of phenyl isopropylamine, and it is optically active. It is optically active because this carbon is optical. This carbon is chiral carbon, because it having one hydrogen here, CH3, CH3, CH2, and hydrogen. So all these four groups are different. So they are the carbon which attached to four different groups, that is called as chiral carbon. So it having this chiral carbon, and it is due to this chiral carbon, it is optically active, and dextro form is found to be more potent than levo form. So it having two form, that is dextro and levo rotatory. So dextro form is found to be more potent than levo form, and the uses of this amphetamine is, it is used in the treatment of narcolepsy and alcoholism. It is used in the treatment of narcolepsy and alcoholism. नार्कोलेप्सी म्हणजे त्या पर्सनला, एखादा जो पर्सन असेल त्याला नार्कोलेप्सी झाला असेल, त्याला झोपायची खूप इच्छा असते आणि एकदम इट इज वन टाइप ऑफ डिसऑर्डर. अँड इन अल्कोहोलिझम इट इज द पर्सन हू इज ॲडिक्टेड बाय अल्कोहोल, दॅट इज कॉल्ड एज अल्कोहोलिझम. मद्यविकार म्हणतात त्याला मराठीमध्ये. So these are the uses of this narcolepsy. These are the uses of this amphetamine. It is used to treat narcolepsy and alcoholism. Narcolepsy and alcoholism. Then the side effect of this amphetamine is, after prolonged use, it results into psychic state of suspicion and paranoia. It results in psychic state of suspicion and paranoia. Suspicion म्हणजे तो कोणावरही असं म्हणजे संशय वगैरे ठेवतो, म्हणजे संशयी वृत्ती होते त्या माणसाची. अँड paranoia is one type of mental disorder. So these are the side effect of this amphetamine. Then next class is thorazine or phenothiazine, and the example of this thorazine or phenothiazine is chloropromazine. So this is the general structure of phenothiazine, where this R1 is equal to hydrogen CH3 or CF3. R1 is equal to hydrogen CH3 or CF3. R2 is equal to CH3, and R3 is equal to hydrogen or CH3. So this is the general structure of phenothiazine, and this is the structure of your chloropromazine. Actually it's the spelling mistake is there, it is a chloropromazine. Say chloropromazine. So here clear your mistake, it's a chloropromazine. Same mistake is there, chloropromazine. So this is the structure of chloropromazine, and these drugs have a heterocyclic ring system called as phenothiazine. So it having this heterocyclic ring system, that is called as phenothiazine. It having two this heteroatom, that is sulfur and nitrogen, and having substitution at 2 and 10 position. It having substitution at 2 and 10 position, and numbering start from this carbon 1, 2, 3, 4, 5, 6. It's a 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. So these are 10 position, and you are having this 2 position. So substitution will be at 2 and 10 position. So the activity of phenothiazine increases if substituted at 2 position. So there is a increasing activity if there is a substitution at this 2 position. So if this 2 position is substituted, this phenothiazine having the activity of this phenothiazine will increases if there is substitution at this 2 position. So this chloropromazine is given orally or by intravascular or intravenous injection. So it can given by oral or intravenous or intramuscular route of drug administration. So in patient with major psychosis with agitation, it produces psychomotor slowing, emotional quickening, and decrease the anxiety without affecting wakefulness. So the in patient with major psychosis with agitation, it produces psychomotor slowing, emotional quickening, and decreases the anxiety without affecting wakefulness. The subject will become quiet and show the indifference in two events around him. So it can lead that, and so this chloropromazine blocks condition of avoidance response. It blocks the condition of avoidance proton. This chloropromazine, the side effect of this chloropromazine is it blocks the condition of avoidance response, so that the person forget what he had learned. This is the side effect. The person forgot what he had learned, and the chloropromazine is used in minor psychiatric disorder, neurosis such as anxiety state. It depresses the chemoreceptor trigger zone, that is CTZ, and thus act as a powerful anti-emetic agent. It is also used for blocking certain action of adrenaline and non-adrenaline as it passes androgenic blocking effect. It also uses as a muscle relaxant property. So the uses of this, it having muscle relaxant and anti-anxiety property. So this is all about the classification of CNS drug. So CNS drug has been classified into 6 types. That is phenytoin, first class phenytoin, and the example is your the first class is hydantoin, and the example is phenytoin or dilantoin, and the second class is your oxazoline ion. Example is trimethadone or tridone, and second one is your benzodiazepine class, and the example is alprazolam. Then fourth class is your pyrrolidones. The example is Keppra or levetiracetam. And fifth one is your Phenylpropylemine. An example is Amphetamine. The sixth and last one is your phenothiazine, and the example is chloropromazine. This is all about that. So thank you.